We will next go to number 73, Nancy Kapplan.
Hello, good evening, and thank you for hearing my testimony. I am here in support of 1067. I have been a nurse for over 42 years, have worked in federal and public and private institutions. I retired from Yukon Health in 2017 after 22 years there. And the reason that I left the bedside was because of lack of support from nurse management and for the moral distress that I experienced because I could not care for my patients the way that they needed to be cared for. I went into nursing to take care of people in the same manner that I would want my family member to be cared for. So when I have your husband in front of me, I'm caring for him like he's my husband, like he's my brother, like he's my father. And unfortunately, with the lack of staffing ratios, we do not have that option anymore. I was able to reset myself and realize that I am a nurse at heart. So I went back to nursing in 2021, and it was during the COVID pandemic. I found that working in a smaller community hospital gave me the opportunity to work with patients who had less acuity. And at that point in time, we had what I would consider adequate staffing. However, as the year has gone by in this small community hospital, I frequently find myself with no one to watch the monitor, no one to help me as a CNA, and also as the only nurse on the ICU and the only intensive care nurse in the hospital. Now, this has created some very, very scary events in our hospital. We have had patients who have coded with only one nurse on, where the code blue has not been responded to by administration or by doctors or by people in the ED. And this is totally unsafe. And if we had minimal staffing, I believe we would have had the two nurses that we needed to initiate the code, care for that patient. And I hear a lot of discussion here on this forum today about staffing committee meetings. I'm not 12 and I understand what good staffing looks like. I have spoken with administration on numerous occasions, only to be told that, well, of course I could take 4 level 3 patients because this nurse director had taken them, and of course this medication that I'm giving is not a vasoactive drug. I am critical care certified. I am ACLS certified. I know which drugs are vasoactive, and I'm not receiving support from administration. And I'm not sure if it's because they have not been at the bedside for such a long period of time, or because the bottom line is they don't have the staff. I implore you to put in staffing.
But your time is up. Thank you.
Thank you, Ms. Kapplan, and thank you for your testimony, for your time here with us today, and for all of the work that you've done. I was struck by your comments about the moral hazard and have seen that in some of the emotion expressed in testimony today. So I thank you for taking time to be with us. Next, we are going to go, I believe, Amanda.